Welcome to Santa Ana College and our town hall to get more information on vaccines. I'm Dr. Meryl Flores, and I'm the interim president of Santa Ana College. This event is open to the community, as we do with all events at Santa Ana College. And so before I introduce our wonderful speakers, I wanted to also invite you to a couple of other community events. First of all, I'd like to invite you to our first round of regional men's soccer playoffs. Yes, go Dons, we made it to the playoffs against Irvine Valley College, and that will be tomorrow at 11 a.m. here at Santa Ana College on our soccer field. The second is our finest performing arts theater performance Time of Your Life, which is tonight, Saturday and Sunday at 7 p.m. in Phillips Hall. So again, this is an opportunity for the community to feel free to ask questions, to get more information, and really get to understand how we can work together to continue to make our community safe. With that said, we hope that at the end of this, it will inspire you or at least get answers to some of the questions that you have had. And join us at our vaccination clinic that we are hosting here from 3:30 p.m. until 7 p.m. Parking is free and appointments are available. You can do appointment online or you can just show up in person. Walk-ins are definitely welcome. So without further ado, I want to go ahead and turn it over to two wonderful partners of ours. The first is Dr. Ilan Shapiro, who is the medical doctor of health education and wellness with Ultimate. And the second is Loretta Ruiz, the associate director with Latino Health Access. Please join me in welcoming. Thank you.
Thank you. Thank you so much, Doctor. We certainly want to thank Santa Ana College for hosting this community event, and also the Orange County Healthcare Agency for providing today's vaccination clinic at SAC. Remember that we will have all the vaccines today until 3 p.m. and there's plenty of parking at Santa Ana College. And of course, we want to thank Dr. Ilan Shapiro, our speaker from Ultimate. And before, we begin, I need to provide you with a legal notice on confidentiality. Please be informed that this forum will be recorded and your personal information can be seen or heard by other people. We welcome your general questions from the audience at the auditorium at SAC or via Zoom. But if you have a particular case that you need to discuss, you can contact the medical staff at SAC, or you can contact Latino Health Access at the call center. The number is at my back. We have created a list of questions, and this is how we would like to proceed if everybody is okay with it. Our promotoras helped us create a list of the questions, the most common questions heard in our community. And we're going to start asking Dr. Shapiro those questions, and then we will leave at the end a space for questions and answers from our audience. So Dr. Shapiro, the pandemic has affected our community in Orange County tremendously. We have seen the highest numbers of COVID cases and deaths in cities like Santa Ana and Anaheim, with the highest population of Latinos in Orange County. And yet we are still the lowest, we still have the lowest vaccination rates. Our vaccination rates are about 44% for the Latino community. We know that there's some hesitancy in our community. We know that people have questions about the vaccine, and this is the idea of having this forum, or people just haven't had the time to get vaccinated. So our first questions, Doctor, if you could share with us, please, what are the most important things that people need to know about the vaccine? Is it safe, for example?
First of all, thank you so much for the invitation. I think that we need to have more forums like these ones because, you know, I don't know what you're feeling, but when everything is changing so fast and we have so much new information, I feel afraid. I feel, you know, that what's happening, and you know, and we get this perception of things changing so fast. What's the real information? What do I need to protect myself and my family? And a lot of the times, the answer is clear and there. But when they put so much fluff and cloud and, the news and politics and all that stuff, then I'm coming here, first of all, as a physician, and most importantly, as a human being, to share with you what we have learned, and of course, why this is happening to our community, and why it's so important to actually engage in opportunities like here right now, Loretta, of just talking and having a conversation about feelings, about where we are, where we want to be, and most importantly, answer the questions. And you asked me a couple of questions. If it's safe, how are we doing? Why our community is not getting the vaccinations? We have seen, and this is actually something that it's has been constantly seen in the COVID-19 pandemic. We have seen that from the beginning, we were the last ones to get tested, the last ones to actually get, treatments and opportunities to get protected. We were the last ones to actually get enough vaccines in our communities. Actually, if all of us remembered, it was very hard to get access to vaccines at the beginning. You needed to dance and the code and the language and the internet and the hours on the phone. And there was a horrible things. And plus, after that, well, barriers. We didn't have enough vaccination centers around our communities. Then it compiled a lot of things. Then what's happening right now? Well, it's a combination of all of these factors. A lot of the family members are still working as essential workers, having 2 or 3 jobs, asking their bosses to just say, well, you know what, I'm going to take one day off or a couple of hours off to get my vaccine. A lot of the times this is hard because if we don't work that day, there's no paycheck, there's no food directly at that moment on the table. Then it creates a lot of things. That's why we're making it easier all the time. We're actually combining, for example, vaccination sites with food, with food dispensaries. That way, like at least if there's an issue, at least you get options and opportunities at that moment. Same thing with transportation, and we're trying to help as many people as possible. And to the point right now, Loretta, that, for example, right now that we're starting to vaccinate kids from 5 to 11, we're going to, the parents will have the opportunity to get their kids vaccinated when they are at school. That way, they don't need to lose a day of work and stuff like that. And you asked me something very important then, and it's real, the safety issue. What about the side effects? What do we know about this? I can tell you for sure that right now, half of the world has at least one COVID-19 vaccine. And here in the US, at least 200 million. And I'm going to go a little bit lower on age gaps right now from 12 to 17. It's on the millions. And right now, at least almost one, I think, I'm probably going to be off with the number, but the last number that I saw was around 1.8 million kids from 5 to 11 got vaccinated in the past 2 weeks. Then good news is that we have not seen anything out that has poked our eyes. And what do I mean with this? Is there side effects? Yes, familia, there's side effects. Yes, there are side effects. You have, some bone pain. You probably will feel a little bit tired, maybe headache, and of course, pain on the arm. That's the most classic thing, and that's very common in all ages. I'm going to talk a little bit more about other questions that they may have, and I'm completely. I have been vaccinated. I got my booster shot. My wife got her booster shot. My kids were vaccinated last week, and probably, if it's okay with you, I'm going to later on when we talk about kids, I'm going to showcase the video. That way they can see a little bit more on the content of that. Us as adults, we usually are more terrified than kids because usually kids do way better than us. Then my entire experience from my family, myself, and everybody else, we're good. We're good, and this is the moment that, and I am calling it, Loretta, the like we have like the 2 weeks, the 2 golden weeks. If we get vaccinated right now, we'll be fully protected before Christmas. Then that's what we want. That's what we want.
Yeah, that's exactly what I was gonna go. And yes, we have seen that kids do a lot better than we do. Doctor, is it the same dose for kids than adults?
It's a great question, and we have two for kids under 18, teenagers and kids, um, from 12 to 17. It's the same dose, same formulary, same absolutely everything than adults, with Pfizer, and because that's the only vaccine that we have for pediatric patients. And the other one from 5 to 11, it's 1/3 of the dose of the adult one. And if you can see the vials, there are different colors. One is actually orange, the other one is purple. They make it very visual that way. We try to avoid that problem. And why 1/3 of the dose? And what's the magical thing between 511 and 12? Do they become pumpkin after 12? Let me tell you how actually they ended up with these numbers. They put all the kids together, and some of the times with medications and medication and also treatments and stuff like that, kids have a different dose, sometimes a little bit higher, a little bit lower, depending, on the medication. Then right now, Pfizer started measuring what was the perfect dose. And the perfect dose for kids to do two things. One, to make sure that it's safe, because it needs to be safe. You don't want to, start harming more people than actually saving. And the other one is if it's working, if it's protecting kids. Then let's talk about the safety part. They started noticing that, all the kids from 5 to 11 had less side effects than adults and teenagers. That was kind of comparable, straightforward and comparable. The second thing was that what was happening? Well, they were having a little bit of fever, malaise, bone pain, chills, a little bit of headache. Sometimes it's not all of them. It's not, but those were the most common. And the number one, top one side effect was actually pain on the area. And that we see the same thing with influenza, with right now with COVID-19 and other shots. It's part of it. And all the stuff that we're talking about, even though that we call it side effects, it's the way that the body responds and creates antibodies. And that's kind of the normal process that our body gets to that point. And okay, well, Dr. Shapiro, I hear you. You're telling me that it's safe. There's like mild side effects that we can control. Good. Is it working? Good news again. 90% of activity. That's awesome. That's amazing. That means that it's very protecting our kids, it's protecting our families and community. Above 90%, that's amazing. We have very little amount of vaccines in our arsenal against a lot of diseases that are as effective as this one, and this one is really good.
Thank you, doctor. And now that the kids are back in school and we want to gather with families, family with our relatives, it is super important to get the kids vaccinated because we do not want them to, get older adults or other family members ill. Is there a special way to talk to children about the vaccine, about getting vaccinated for COVID?
The answer is yes, yes, and yes. And we need to be very, very truthful. And I'm going to start with the first thing. As a parent, we need to explain why are we doing this and how vaccines work. And the best way to explain this to our kids is to make sure that they understand with the vaccine, they will get like a picture to their system. And that picture is kind of this is the bad guy. And we're going to train our soldiers and police officers inside of us to make sure if they see this picture, that's the bad guy. Make sure that you neutralize it and make sure that it doesn't pass the defenses. And that way we're ready looking for it all over. And that's one of the most important things that we have right now. The second thing that we need to explain them, and one of the most common errors, is that we do not want our kids to suffer at any time, right? We want them to be, shielded of pain, tears, and everything else. But the reality is that, you're putting a needle on the arm, it hurts. Then telling them it doesn't hurt, it's not even a numbing cream. You will create a lot of issues with your family members. And tell them the truth. It will hurt a little bit. It's not going to be the best day of your life, but not even close to the worst one in your life. Then make sure that you tell them that part. Tell them that you will probably have like certain medications that you can buy in any pharmacy if they have any pain or discomfort. And also, like you can use, warm compresses or cold compresses to actually alleviate the pain of the shoulder. And I can share with you, Loretta, that I vaccinated my kids, and let me see if I can actually pull that out right now. Um, and they did amazingly well. And by amazingly well is that, I cried more on my vaccine, and I was more tired with my vaccine, and I was suffering more with my vaccine than anything else. For my kids, it was just amazing. And I'm going to take the control of the
Sharing your
the
screen, of course.
yeah, the screen. Then I'm going to be using this, and this is my son and stuff. I'm going to start. I don't know if you will actually get to hear it, but I'm going to try anyway. And I'm even without sound, you will get the point. Even my son says it tickles. Then and I'm saying that's a first, and he did perfectly well. And you can see there that it really, I was more worried about my kid, the process, the reality of what actually happened there. Right now, again, my kid, my kid is getting prepared, and again, they're putting the shot in. He didn't flinch. He didn't have anything. He said, and it's clear that one thing is the perception that we have as parents, and the other thing is how can we prepare our kids for this. And they take it way better than us. A lot of them understand that this is a way that it's not going to solve all the problems of the world, but at least for the first time they have been hearing all our agony of getting the vaccine and fighting for the vaccine. And right now most of my patients feel relief. That's quite interesting.
Yes,
Relief of actually getting the vaccine and being part as mom and dad, part of that, group of people that are protected.
definitely. Yes, we agree with you. We've seen that the most affected group worldwide because of the pandemic have been the kids, not, being able to go out and, play and have their play dates and go to school and have, their friends or younger kids, go to the movies and see their peers. So I definitely think that the vaccine give them, it gives them hope that we're going into the right direction. But as parents, we still have questions. Like, there's parents who have asked us, like, if the vaccine can alter their puberty, if it can cause hormonal problems in the children.
Sorry, I didn't hear the last part. Can you repeat the question?
Can the vaccine cause a hormonal problem in my children?
Loretta, we have seen a lot of things, and they have been asking me that about early puberty, and they have been asking me, the second one has been about fertility. Then right now we have information for almost 1 year. The only thing that we have seen that is correlating, especially with females that already menstruating, is that their cycles can be altered for like two cycles. It could be faster or slower for menstrual cycles. That doesn't happen to everybody, but that's something that it's happening, and it has been reported. For kids, I have the really good news, and that as a parent and as everything that we have as a pediatrician, as almost 1 year of information that we have not seen anything getting close to infertility or problems like that. Then, and I always joke with this because a lot of parents are like, oh, do I get the shot instead of using anticonceptives or birth control pills? So like, no, 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 it will not work. It will not work. It will not work. Do whatever you need to do, but not the COVID-19. You will still get kids with the COVID-19. But on the other hand, Loretta, the thing that we need to talk about is that um, the contrast with this is that actually the COVID-19 virus can reduce the amount of sperm that we have, one, and the other one, it can actually create something called that is, decreased function of the male organ. It can have actually, erectile dysfunction. Then we do have a lot of information if you get the infection that it actually will hinder your ability to procreate and have kids rather than the vaccine, then still the best choice that we have right now, by far, is getting the vaccine.
Yes, of course, I hear you. Thank you, doctor. I have a couple of questions in regards to pregnant women. One is that if the vaccine affects the baby of a pregnant woman, but the other one is that if that person does not get vaccinated and that person gets infected, what could be the consequences of the pregnant woman and the baby if they get COVID?
I have, during the beginning when we started using, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine, we didn't know specifically what was going to be, if it was going to be safe. We thought that it was going to be safe, but we didn't have the data for it. Then we thought about it. Then a lot of ladies actually got pregnant during the vaccination period or during the research, and we started like comparing if it was safe or not. Then the first recommendation that started at the beginning was like, oh well, wait until the end, almost like when they are going to give birth, to give the vaccine. Right now, we know as a fact, then it's safe at any trimester, to the point that it's recommended that any pregnant woman, and sadly, less than 25% of pregnant women actually getting the vaccine. On the contrast that, in England, 1 in 5 intensive care unit beds are from pregnant women. Then they are getting very, very sick because of COVID-19, and they're getting sick, and their babies getting sick because of COVID-19 inside of them. Then we know right now that protecting pregnant women is one of the priorities that we have, because the value of 2 lives is, there's no words, it's 2 lives. Then that's why it's so important to make sure that we're getting vaccinating everybody else. And that way we have seen, the kids actually are born with antibodies, are protected with mom's vaccine. And the other thing is that breastfeeding moms are actually giving the antibodies to their kids. Then breastfeeding is actually helping them also. Then you have all the synergies of protection for the kids and the mom when they are getting vaccinated.
That is beautiful. So the advice is that women who are pregnant, they really need to get the vaccine to protect them and the babies.
Yes, please.
Now, doctor, I have a few questions about immunity, and I'm gonna take a question from the chat. This person is asking that there's been 9 months since she or they got vaccinated. I'm not sure if she got the two doses. I am assuming that she only got one, because she says, what should I do? Should I get a booster shot or get vaccinated again? So people who miss one shot, what's their advice for them?
Get it right now. Get it soon enough, and right now you're in good time to actually get your body. You don't need to start again. We're not recommending that. For example, we have a lot of family members that come from outside that they have weird immune response, or they have different vaccines that we don't have here in the US. And then yes, for them, yes, they need to start from zero. And no matter how many vaccines they had, if they are not recognized by the US or the World Health Organization, the recommendation is yes, get everything before. But for this mom or sir, it will be important just to get the shot now, and a couple of months afterwards get the booster shot.
Perfect. And talking about booster shots, today in the news they mentioned that Pfizer has authorized boosters for everyone. What does that mean?
Well, one of the things that we have seen is why booster shots and why we need to get poked again. That's a great question that we have, and the other question that I will add there is that the hardest part is, how can we help each other with changing times, right? When is this going to get over? What we have seen is that in this period we were measuring how often or how long the antibodies were going to be produced inside of our bodies. For other infections like polio, pneumonia, and other ones, we actually have multiple vaccines, like 3 or 4 or even 5. to make sure that our body is creating enough antibodies that will last for a long period of time. Specifically with COVID-19, we started seeing that after 4 or 6 months, the vaccines rate will actually start going down to the point that, we were not that protected. Then we started here in the same way as other countries. We started actually getting the vaccine to people that needed it first, people that had cancer, problems with autoimmunity. We started doing the booster shots for them. Right now, because this virus doesn't distinguish who you love, what you do, where you are, what language you speak. Right now, we're seeing it that we need to protect absolutely everybody, and absolutely everybody is any human above 18 right now can get access to that booster shot, and that actually is for Pfizer and Moderna. And the same thing, that's 6 months afterwards, or if you have Johnson & Johnson, 2 months after, you can get your booster shots. And Loretta, I don't know if you remember, but it was horrible to find, where do I get the Johnson & Johnson and getting the combination and the callback. Right now, you can do mix and match, meaning that you right now for your booster, you can actually mix, vaccines. That way, you don't need, if there's in your location, you only have, like, for example, Pfizer, get Pfizer. And if you only have Moderna, get Moderna. And that would actually help you more than, just waiting and figuring out when you're going to get your shot.
Of course. And remember, just to the audience, that we will have all the vaccines available today until 7 p.m. at Santa Ana College. There's free parking, so you still have time. No appointment necessary. We'll pre-register you here on site. The entrance is on 17th Street. Doctor, do you think that we will have to receive a COVID vaccine annually? Have you read anything about that?
Dun, 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 dun. It's a great question, and I'm going to give you an honest answer. The honest answer is that we need to be checking a couple of things. If we see that on the long term, we started seeing that the antibodies, they're not enough from that part of it, that protection key that we're doing right now, probably we should. If we're starting to see more variants and more issues out there that are hurting our community, yes, we should. If we start seeing that more people are getting on the hospital or getting very, very sick, yes, we should. Right now, probably a third one will, we will need to wait a couple of months to see what's happening with our antibodies and figuring out if we actually need the refreshment to our body to remind them how to produce those antibodies, or we will be fine. And that's where we are right now.
Thank you, doctor. So we will be paying attention to doctors and scientists and see what they recommend in the future. Some of these questions that I had here, you already responded to them, doctor. Can people mix vaccines, like, for example, get vaccinated against COVID and at the same time get the flu shot?
Familia, right now we're getting close to winter. Please, 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 if they are offering you at this moment the COVID-19 vaccine and the flu shot, get it. We were afraid at the beginning of, oh my God, this is going to be horrible, the side effects. Right now, we know that nothing has been happening. And I share with you that after, and you already saw the video of my kid, my daughter actually had it the same day, and both of them got the flu shot at the same time. Then it is what it is. It's better for my personal point of view. There's no more side effects, but having it over and being done with it like that, it's way better than coming back and restarting it.
That is true. So today we decided to have the clinic today on a Friday, thinking that students can rest during the weekend, and if they do get some side effects, some of them will, as you already said. So today is a good day to get vaccinated on a Friday and before Thanksgiving. So you'll have the whole week to rest. Doctor, there's another question here from our community that there are videos where supposed doctors affirm that in many human organisms after having the COVID vaccine, they begin to have thrombosis problems or clotting disorders that end in death. Is that true?
We will be seeing a lot of videos. And before I actually give you the answer, I'm going to talk a little bit about disinformation and misinformation, because I think that COVID-19 is killing a lot of family members, harming a lot of our family members, and misinformation and disinformation and misinformation and disinformation, it's actually hurting more our families. Whenever we see this type of videos and you at the end are afraid and you have this feeling that something is weird and you're very worried, that's the design of those videos. They want to engage with you and make you feel something bad and wrong and doubt, and then that would be my first warning. If you start seeing that part, it's blinking the red flashlight there that something is weird. If you start seeing that that person actually is not a doctor, it's a doctor in philosophy or a doctor in engineering or something like that, be worrisome, because something is weird. The other thing is, what's the history of that scientist or doctor or nurse that is talking to you at that moment? We have a lot of people the same way that we have amazing lawyers, good police officers. Same thing with doctors. We have a lot of people that are not that good, and just make sure that you're seeing the red flags. The other one is that at the end of the video, they go like, oh, by the way, we have this beautiful potion and vitamins here, and get your vitamins and book. Then they're trying to sell you something. Then you should, that will be worrisome of that part. And of course, there's nothing on all or nothing in science. We're trying very hard to make sure that when we are talking science and sharing information, we're trying to do it as directly as possible, as nice as possible, and very importantly, with all our hearts, with everything that we're having. That's a beautiful part that we have right now. Then you already know what are the red flags and the things that we're looking for. Then if you see them, be worrisome. And specifically for that part, we have had specifically with one of the 3 vaccines. That's why it's always important to give. It's not one COVID-19 vaccine. It's all of them are different. And we saw, specifically with one of the vaccines, that for females, they were getting some type of thrombosis. There were 5 cases in 1 million. It's very, very low incidence compared to actually the virus that you get from 100 patients, you get 14 that will have some type of thrombosis problems. I don't know if you remember, but there were a lot of pictures of people that started to have like pink toes and painful toes and fingertips after having COVID-19. Those were thrombosis. We started having after COVID-19 people that were having inflammation of the heart, infracts and other stuff. Then all of those are actually created by the disease. Then still, even though that there was a timeline correlation with this, that doesn't mean that I would stop doing this. There's a lot of things that we are still learning, but right now I know that COVID-19, the disease, is bringing us more headaches by far than any other treatment or preventive measurement that we're using against it. That's still, on that balancing act that we need to do as human beings, as family members, as the amazing, thing that we're doing, we need to balance both. And right now, the best balance for us is actually getting vaccinated.
Thank you, doctor. So definitely, the illness in itself will create more problems than the vaccine. The vaccine, after symptoms that they may have for a couple of days, they do not compare to what the effects that the COVID-19 virus leaves in your body and permanently though. So thank you, doctor. Before going to the other, you already talked about the myths and facts, and I want to take a couple of questions from the audience. One person is saying that her 2-year-old granddaughter, is there any studies going on right now to get small children vaccinated?
They are, and most of them are on the Pfizer area, but I do believe that Moderna will start doing the same thing, and they are pursuing that part. And the idea 4 months ago was that by January to actually have vaccines from 6 months old to all the way up.
So soon, we will have them soon, hopefully. So there's another person, mom is asking, how long after receiving the COVID-19 vaccine will my child be protected?
When they get the first one, their antibodies will be about 70% 2 weeks afterwards. When they get the second one, 2 weeks afterwards, there will be like around 90%. And that's kind of the way that it goes up.
Thank you, doctor. So 2 weeks. The famous microchip. People, and we've seen this at our clinics when we interview people after getting vaccinated at Latino Health Access. People, when we ask them why they had not getting vaccinated, they start, there's a lot of, as you said, misinformation in Facebook or other social media, and people are actually believing it though. The thing about the microchip, people saying also that there's more deaths from the side effect of the vaccine than from the illness. You already talked about that, but what's a good way to get information that is true, that is accurate? Where do you think where would you recommend someone to go and get actual facts?
We do have a couple of websites that I recommend that are in Spanish and English. That are culturally sensitive and most importantly, give you a lot of good information. One of them is the one that I have here, that it's Ándale que esperas. It's a campaign that we are running actually with Latino Health Access and other partners on the entire state to make sure that we have promotoras de salud, healthcare workers, talking with the community, doctors, everybody aligned. That way we can have conversations with the community. The other one that I love is from the American Academy of Pediatrics. It's healthychildren.org. That's an amazing website. And there's other ones like the CDC one. Then make sure that you're engaging, that you're asking. There's another one called de ti depende.org. Then you have a lot of websites there that are like truthful. And most importantly, Loretta, they can come and talk to us. Most of us as healthcare providers, community health workers, nurses, we want to engage the community. Then if there's someone that has doubts and stuff, let us know and we can do as many of these talk as possible. That way, everybody's prepared. And by the way, a lot of people are using fear to paralyze you specifically in order not to do anything. It's better. A lot of people prefer the status quo and go like, and not move rather than actually engage with the conversation, because we have, it's awesome when we have, fear if we have a lion because it makes us run faster, but it's not okay when we do not have right now a lion behind us, and we need to actually get our feelings on one side, and we need to decide with numbers and facts on how are we going to be protecting us and our kids.
Definitely. And Christopher Sandoval from SAC kindly wrote down the call center from Latino Health Access, 714-805-7838. If you have a question, please call that number and we will be glad to connect you with someone. Altamed also has a great campaign in the state, Ándale que esperas campaign. So please feel free to log into their website and get accurate information about your health. This is about protecting you and your community and your relatives, your older relatives, people who have certain conditions that make them more vulnerable. So it's the responsibility of everyone to get us protected. Let me see. Well, this I don't know. I mean, but I'm gonna ask it because it's one of the questions that the community asks. Is it a matter of politics or economics that in some, or is it somewhat convenient that the vaccines that were given in several Latin American countries to enter the US are not valid? So you know that many of the vaccines that gave people in Mexico or other countries, they are not accepted to come and travel into the United States. So people are just asking if this is a matter of politics or economics, or if there's an answer for that.
There's an answer for that. I'm trying to pull back the information from that part. You will see me that I will be playing on the background right now. But the reality here is that we have a lot of things, and there's vaccines. Not all vaccines are created equal. That's the first thing. Not all vaccines are created equal, and by that part is that, you know, when we have a lot of conversations and stuff like that, we need to make sure that we are all taking care of each other. And there's vaccines that will work better than others. Then right now I'm going to steal again the screen and share with you which ones are there. And a lot of the times we have vaccines that work and other ones that are not working that much. Then here are the combination of vaccines that work. We have Moderna, Pfizer, Johnson and Johnson. We have the AstraZeneca one. We have another one that is AstraZeneca one made in India, Covaxin, that actually working pretty well. Sinopharm from China, and Sinovac. Um, we don't have a couple of them that were actually used a lot, including Sputnik. But the important thing is that this is very important for all of us. When there's not a lot of data, or there's data that shows that it's not working that much, that's the way that the WHO is acting and other countries are acting. If there's no data to share, because I can tell you for sure, Loretta, one of the things that I love about Moderna, Pfizer, and Johnson and Johnson is that we're seeing everything. We're even exaggerating or what's actually happening there, to the point that it feels that we are over amplifying anything, and that's, I love that one because it's very transparent, the whole thing. We have other countries that do not have, for example, a strong health system, that do not recovers the information about what's happening on the field. They do not know who got what and when. Then there's a lot of hassles there. Here, it's clear. I can go to my phone, and it has my date when everything has it. The state has it. I have it. Everybody has it. It's very easy to track. But there's countries that they haven't been as lucky as we are. Then and that's important. The other thing is that we have seen that in countries that have certain vaccines, they are seeing more breakthrough rates, or simply no help at all. Then that's why they took those decisions. It's the World Health Organization and the US that is kind of doing that part. Yeah. We have you mute.
Thank you. I think you already responded. Is it true that there are currently more deaths from side effects than from the vaccine? You already.
And by the way, it's not. There's no. Right now, there's a system that anybody can report absolutely anything that they want there, including there was one someone reported that they got Hulk superpowers on that system. Imagine that you can actually really put everything there. On that system, the mortality rate of vaccines is 0.0017%. It's comparable to getting hit by a lightning. Then I feel safe.
Yes, definitely. Thank you, doctor. I have a couple of questions here, and then maybe if we have questions from the audience at the auditorium, we can take them. But these two questions that I have, one is, Doctor, I'm days away from my 6-month mark from when I completed my initial vaccine. Can I get the booster now, or do I have to wait until I hit the 6-month mark? I do not know exactly how many days this person is away from the 6-month mark, but can she get the booster now?
Usually, if it's 2 days before, it's totally fine. And most of the times it's not because your body magically knows the difference between 5 months and 2 weeks or 5 months and 3 weeks. But a lot of the times we need to do cutoffs for the systems, for the computers, for all that stuff. And it's easier to just have a close number. And that's why, if it's a couple of days before, that's okay. If it's like 2 weeks before, it's not that your body will go like, oh, no, you were too early, I'm not going to work. No, it's not going to work like that. But maybe the next time that you get another vaccine, they can give you headaches. And if you can wait, that will be awesome.
And then, when you show your card, your vaccination card, actually the medical staff will let you know if you're okay to go or if you should wait. I have another question. This person is saying that, is it safe? She's asking if it's safe to go out in the street, restaurants, shops, etc., without the mask once we are fully vaccinated. So this person, I'm assuming that she's fully vaccinated and she just wants to know if it's safe for her to go out to places without wearing a mask.
On reality, there's a couple of rules. And no matter where you are, because certain cities will have certain rules that are different and stuff like that. But this is actually more like for us to be safe. And the closer we are, the more people, less oxygen, more tightness, less people vaccinated, more problems we will have. Then, if, for example, if you're like outside on the street and you're walking from one restaurant to another and you're in the street, it's safe. It's safe to just not wear a mask. But if you're vaccinated and when you're going in, it would be better to be covered and have the mask. That way you'll be protecting yourself and everybody else. Then, a lot of the times, in the restaurant, it's very hard because you need to eat, and that's the objective of the restaurant. Then there's no magical field around the tables where you're sitting and you take out and but at least you try to do as much as you can on that part.
And you know what, Doctor? I'm sorry.
Yeah, no, please.
Especially in Orange County, where it's not, many places, it's not a mandate to wear a mask, and a lot of people are against it. And I actually have a question regarding that. She says that there's so much discrepancy about the mask. Do they really work?
It's a beautiful question. They do. There's a lot of, I think that there's a lot of, depending on the mask that you use, it could be protecting above 99%. That's the N95. And you have, the surgical mask that it's lower than that, but, it's probably a 70-80%. And after that, you have the, like using the cloth mask, and, depending on the cloth mask and the fabric, and it can go down. But does it work? Yeah. Does it hurt? No. Does it have side effects? No. Surgeons have been using those masks for years, and I don't see surgeons dying in the middle of a surgery because they are using their mask. I have not seen them actually getting brain damage, although neurosurgeons are the smartest surgeons that we have. Going like, oh, I'm dying, and they go like that on the surgery. Or after that, they start having issues with their brain. No, they don't. Then, if these people have done it for years, and we have done it already for almost 2 years, we already know that, is it the most comfortable thing? Hell no. Do I want to trash it away? Of course. Do I want to be smiling to my patients and having interactions with a mask? Yes. Is it safe right now to do it? No. In reality, no. Then, and the same thing at schools, we're seeing it, and it's true that we're seeing more issues and stuff, but, we still need to have that protection.
Yes, it's better to take, I think, those measurements, and it saves you a lot of money on lipstick. So it's 3:50. We have 10 minutes left, and I would like to know if there's a question from the audience at the auditorium that would like to ask. I already went through all the questions in the chat. So if the people at SAC could be kind, you know, to help us and see if there's a question in the audience. Just remember that this forum is being recorded, so please do not share any confidential information. Just ask general questions if you may. We don't have any questions. So I guess everything was very clear. Doctor, we thank you and we appreciate you. I can give you 10 minutes before we start our forum in Spanish, if that is okay. Thank you so much. And if you would like to continue listening to us, you can join this chat at 4 p.m. We're gonna start the Spanish forum. Thank you, Dr. Shapiro. Thank you, Santa Ana College. We'll see you in a bit.